Hello, and welcome to Albany Medical Center's Emergency Medicine Residency Program. We've made this video to give applicants some knowledge about who we are and what makes our program special. My name is Noah White, and I'm the program director here. I was a resident and a chief resident at Albany Medical Center. After graduating, I worked with established residency programs as well as helping to found a brand new residency program. Albany Medical Center, though, is home for me, and I'm thrilled to be back here at my alma mater. The Department of Emergency Medicine has been established since 1988. We see over 82,000 patient visits per year and are designated a Level 1 Trauma Center, Certified Stroke Center, Heart Center, and are the region's only pediatric emergency department. We have a very high acuity level with an admission rate of over 32%. One of the things that makes our department different than most EDs is how well integrated our physicians are through the hospital leadership. The Dean of the Medical College and Executive Vice President for System Delivery Care is a previous chair of our department. As well, the Associate and Assistant Deans of GME are previous program directors. Our physicians also serve as the Hospital Medical Director, Simulation Director for the institution, Regional EMS Directors, the Forensic Medical Director, as well as past presidents of CDEM. What this means for our residents is that our department has a very high standing in the hospital and is better able to advocate for our needs as well as the needs of our patients. ED residency leadership includes Dr. Pause, Chair of Emergency Medicine, myself, as well as our 3 APDs. Dr. Geary leads our digital media, Dr. Chow directs our simulation as well as our didactics, and Dr. Noonan runs our board prep. The heart of any residency program lies with the program coordinator, and Marianne Pallon has been nationally recognized for her years of wonderful service to our program. Our faculty group have a wide range of expertise and fellowship training, including in critical care, ultrasound, simulation medicine, pediatric emergency medicine, toxicology, EMS, sports medicine, research, and international medicine. As well, many of our faculty have masters in education, simulation, and public health. Our emergency department is the tertiary referral center for much of northeastern New York. Our catchment area is over 3 million people and is one of the largest catchment areas of any residency program in the country. Our patients have a wide diversity of age, cultures, and pathology. Our hospital has been named in the top 5% of U.S. health grades, and has well been named one of the most wired hospitals in the United States. Our adult emergency department is a 21,500 square foot department, including 64 beds spread over 5 zones. We are currently in the process of designing and remodeling the adult space to better suit our needs as well as the needs of our patients. The brand new pediatric emergency department is directly attached to the adult emergency department. It includes 2 floors, with the bottom floor being the primary emergency department and the second floor being a pediatric observation unit. We as well have brand new ED offices and state-of-the-art educational spaces on the 4th floor of this building. Our curriculum is divided into 13 blocks, each 4 weeks in duration. We believe that emergency medicine residents learn the most in the ED as well as in critical care settings, and as such, we have set up our curriculum to reflect this. We start with an orientation block where we get to know you as you get to know our department. Throughout the intern year, there are 7 blocks in the main adult emergency department, as well as 1 dedicated block within the pediatric emergency department. As well, there are rotations in the MICU, SICU, and 2-week rotations on OB, ultrasound, anesthesia, and a 2-week ortho rotation. During the PGY2 year, our residents spend 10 blocks within emergency medicine. During this time, pediatric shifts are integrated throughout the year for a longitudinal experience. In addition, there are rotations for the PICU, CCU, 2-week tox rotation, and 2 weeks for a selective. For this, our residents are able to pick a subspecialty that they'd like to explore more, such as critical care, ultrasound, sports medicine, international medicine, or any other area that we have faculty expertise. During our PGY3 year, our residents spend 10 blocks within emergency medicine. Again, the pediatric experience is longitudinal throughout this time. In addition, they spend time in community emergency medicine, EMS and administration, and have one block that's open for elective time. We have our didactic series every Wednesday from 8 a.m. until 1 p.m. Recently, we have revitalized our didactic series with an emphasis on small group education. In addition, we have an integrated simulation and cadaver lab experience through all 3 years. This has been highly received by our residents and provides them with a safe place to practice resuscitations and procedural skills, including chest tubes, central lines, lateral canthotomies, crikes, and thoracotomies. We work 9-hour shifts, with the first 8 hours being direct patient care, and then the last hour being protected time for sign-out, wrapping up patient visits, and completion of any charting that's still due. As clinical expectations increase over the 3 years, we decrease the number of shifts per block, with PGY1 residents working 20 shifts per block, PGY2 residents working 19, and PGY3 residents working 18 shifts per block. There are 4 weeks of vacation each year integrated into EM blocks. This means that when a PGY1 resident has vacation during a block, they will only work 15 shifts. We are a Level 1 trauma center, and we are the busiest trauma center in all of New York State by a wide margin. Our residents perform all airways as well as fast scans. Having this large trauma volume means that our residents get to perform a lot of resuscitations and procedures. It also means that our graduates are exceptionally trained for any hospital that they may go on to practice at. We started up our EMS fellowship, and we'll have our first fellow starting in July of 2017. Our PGY2 residents provide online medical control, such that when paramedics call in, they're able to speak with one of our residents to ask for advice on cases. Our residents perform ride-alongs with our paramedics. As well, there is flight experience that is available, but not mandatory for our residents. There is plenty of event coverage that is optional as well, including local college sports, as well as mass gatherings including the Lake Placid Ironman and many local marathons. There's additional training that's available for those that are interested in EMS fellowships or postgraduate jobs. Our ultrasound fellowship began 2 years ago with multiple fellowship-trained EM faculty. Our residents use this constantly on shift and develop expertise very early in their residency. We routinely use ultrasound not only for common studies like fast scans, gallbladders, renals, and aortas, but as well to augment physical exams with bedside echoes, DVT studies, ocular ultrasounds, pulmonary, and orthopedic scans, all of which are routinely reviewed by our ultrasound faculty, and feedback is given to our residents to help build their skills. We benefit from having a large, extremely well-equipped simulation center and have sim built directly into our curriculum. The center has state-of-the-art mannequins, as well as a number of standardized patients to aid with education. Our sim cases focus on the most critically ill cases so that learners are able to gain maximal education. But all of this is done in a non-judgmental, supportive environment. This allows our learners to practice in an environment where it's okay to make mistakes and to grow from them. We realize that residents have variable levels of interest in scholarly activities. Because of this, we have made it a very easy requirement to fill for some, while encouraging those who have an interest in research to join with faculty on projects. Our residents commonly participate in original research and online publications, as well as clinical pathologic case presentations and regional and national presentations. Travel funds are provided for any conference where a resident is presenting. In the most recent academic year, we had 35 publications from our department. Everything that I've shown you so far, I think, speaks highly of our well-established training program that we have here at Albany Medical Center. We have decades of residents who have graduated and gone on to excellent careers, and we constantly have hospitals that have hired our graduates try to recruit more. From this, I think that we represent the best of an established program. However, the last few years, we have been hiring more faculty and expanding our facilities. Because of this, we're at a moment of growth for our department and for the residency from an educational standpoint. We are looking for applicants who want the safety of an established program with the energy and creativity that come with a new program. We are currently in the process of developing multiple departments for this. One of these is international medicine. We have 4 faculty that have ongoing projects in other countries. These projects include drop-in clinics, well-established clinics, as well as educational teaching sessions that they perform overseas. Wilderness medicine is a natural fit for us with the abundant parks and recreation in the area. We run an annual MedWar, a wilderness adventure race, here for the residents. As well, there are many opportunities for residents to become involved in wilderness rescue. We are pleased to welcome Dr. Andrew Chang to our department this year as Vice Chair of Academics. Dr. Chang has an extensive research program that he has developed, as well as being one of only a handful of emergency medicine researchers nationally to be awarded an R01 grant by the NIH. One of the hardest things about performing clinical research as a resident is being on call 24/7 to enroll patients. As such, we have research associates staffed in the emergency department to identify patients meeting criteria for studies, obtaining consent, and data collection. With all of this, our department is going to take a robust research program and expand it exponentially over the next few years. We really do consider our residents to be part of the family. It is one of the things that brought me back to Albany Medical Center after years of being away. While we do work hard in the department, we also play hard in the natural beauty that surrounds us. As well, Albany is home to fine arts, a fantastic food scene, and I am personally amazed by the number and quality of concerts here in the Capital Region. We are looking for applicants that are going to appreciate our well-established history of academic rigor while helping us grow into our future, who will enjoy our work hard, play hard philosophy, and who will want to be part of our family. I want to thank you for your time, and if you have any questions or anything that we can help you with, please don't hesitate to contact us.